Hello, and welcome to Holistic RI, a wellness collaborative dedicated to root cause healing for the mind, body, and soul. We believe that when you are leading your own healing process, you are empowered to make lasting changes in your journey towards health. Offerings range from personalized and preventative medicine specializing in gut health, integrative physical therapy, herbalism, and coaching, to Reiki, reflexology, and massage. We specialize in lifestyle root cause exploration. Please note the following disclaimer. This video is for educational purposes only. Please consult a professional. This is not a substitute for care, and individual results may vary. By watching this video, you acknowledge that you are responsible for your own health decisions. Welcome to Holistic RI, where we believe you should lead with your heart and listen to your gut.
Hi, my name is Rory. This is Keryn from Holistic RI. Keryn's here today to talk about what brought her into holistic healthcare. Keryn?
Hi, yes, I am the functional nutrition coach at HRI, and my journey into holistic healthcare dates all the way back to about 20 years ago. When I was first out of college, I took a job as a chiropractic assistant with a holistic chiropractor who was very philosophy based, and she taught me, along with the rest of her patients, about the body's innate ability to heal itself, which was a new concept for me. But as I worked with her, I saw transformation happening with her patients and with my own health. So it made me very interested to start learning more about the holistic health field. I started to study massage therapy while I was working with her. And I knew that I wanted to have my own practice and try to help people through the power of touch. I was also Reiki certified at the time as well. So I had it from different angles, more, like a hands-on physical approach, but also I had some energy medicine knowledge also. So that was in my early 20s that I started getting into it. As I moved in through my career, I worked with different types of holistic health professionals for them and with them, different offices, things like that. And I just kind of absorbed all this information. And I realized that in my own health history, I had a lot of issues that I had dealt with even as a baby. I was diagnosed with asthma when I was 2. I was a brittle asthmatic, actually. I was in and out of the hospital all the time. And it was a time before home nebulizers. Seems like really a lot. But so I had to go in for those treatments, and I was in for long periods of time. So I was dealing with that. I had lead poisoning when I was a toddler, and I had to overcome that. But when I look back on it, for those 20 years of my life, I had been on lots of medication. So steroids, antibiotics, all these different things that helped in the immediate, of course, like in an acute situation, they were needed. But it was also, I didn't realize this at the time, but it was doing damage on my body. So as I entered into my 30s, I started feeling not well and wasn't sure why. So that got me into learning about nutrition and learning about functional medicine. And I worked with, as a patient under a functional medicine practitioner who helped me when I was diagnosed with Graves' disease and hyperthyroidism. And through functional medicine, I was able to get off of my thyroid medication and basically reverse the hyperthyroidism. And so after about a year of doing that, I was off my medication completely, which made doctors very uneasy when I would see them.
Yeah.
Really, every time I would go, he wanted to just get rid of my thyroid. That was the answer. You have hyperthyroidism, we're going to get rid of your thyroid, but my thyroid levels were good. So to me, going back to what I had learned from that mentor, that chiropractor that I had worked for in my early 20s, that knowledge that the body has an innate ability to heal itself was always something that was in my mind, the voice, very loud throughout my whole, career. So I knew that I felt better. I was doing healthy things. I changed my nutrition. I was taking supplements that were supporting my thyroid. My thyroid levels were good. And I put my foot down and said, no, I don't want my thyroid taken out. And for anybody who knows me, knows that that's a big deal, because I tend to be a non-confrontational person. I do listen to doctors, especially with my history of being in and out of the hospital so much. I do listen to them, and I follow their advice for the most part. But this just felt really wrong to me. So that was about 13 years ago. And since then, I've reversed my Graves' disease. And I have no signs of Graves' disease, so no thyroid issues. My thyroid levels are always what they call stellar every time I get them done. And I can directly attribute that to functional medicine. And because of that, it made me want to be in the realm of functional medicine, not just have it as a hobby of reading about it and implementing it in my life. I decided to go to the Functional Medicine Coaching Academy and become a functional medicine health coach during the pandemic, when everyone was freaking out, especially massage therapists, because we didn't know what we were going to do. If we were back on people, what are we going to do? So I knew that this was something, a passion of mine, that I wanted to go forward with. And since I've done that, it's been so rewarding. Being able to work with clients and teach classes. I kind of feel like I stepped into my full light in this community.
That's beautiful. It's so inspiring to hear things like that. And I love that you pointed out that you typically do listen to your doctors, because that's, and I know with functional medicine, you want to work with your doctors, and not against them. But I think, can you kind of listen to your own wisdom and help healing that? I think that's fantastic. I know you had a story you talked about. This was like some of this was during while you were pregnant, correct?
Yes. So I still had markers for Graves' disease when I was pregnant with my now 7-year-old, well, almost 7-year-old. And because of that, and because of my age, they wanted to keep a closer eye on me, especially at the end of the pregnancy. So I had to go in every week to just lay on the table. They did the ultrasound to make sure the baby was moving a certain amount of times in whatever time span they allotted. And so every time I went in, I had to tell the nurse, it was usually a new nurse every time, a little bit of my health history. And so the main thing that came up was the Graves' disease. And so they asked, okay, what medication are you on? And I say, not on any medication. What do you mean you're not on any medication? Well, I see an endocrinologist and my thyroid levels are great. I don't need to be on they And every time I would tell a nurse that, they looked at me like I had 3 heads, but also they were all like kind of in awe of that. Like it wasn't something that they heard every day, obviously. So
Yeah.
actually, there was one nurse in particular that wanted more information. So I gave her the name of my functional medicine practitioner I was working with, and just told her, what I had done, just changing my diet and taking supplements. So that was, 7 or 8 years ago. And then in between that, I had another baby about 3 years ago. I was diagnosed with thyroid cancer because I felt a lump on my neck, and it turned out to be a cyst above my thyroid in this thing called the thyroglossal duct that we typically don't have. It usually disappears when the thyroid is formed, but for some reason people can hang on to them, and I hung on to mine. A cyst grew in there and developed cancer, thyroid cancer. So another thyroid issue. And they removed it, but the fear was that because it went into some of the muscle tissue, they were afraid it was going to go into my thyroid. As we were figuring that part out and they wanted to take out my thyroid, I became pregnant with my now almost 3-year-old. And they decided to, leave it alone until I had the baby, till I was done nursing. And when I went back, my thyroid levels were amazing. There was no sign of cancer. So my endocrinologist believed that I didn't need to get the thyroid removed. So what I do now is I support my thyroid health with supplementation, with, my nutrition, and I get a CT scan every year just to make sure that nothing is growing in there. But I, knock on wood, it's been almost 3 years since I had to deal with that. Actually, it's been 4 years since I had the cancer diagnosis. Cancer-free, Graves' disease-free, hypothyroidism-free. I reversed all those things with functional medicine.
It's beautiful.
Yeah.
Yeah, I think I think these are all amazing stories. And I think it's good to point out that we can help we can help people, or functional medicine in general can help people kind of prevent different chronic diseases or chronic issues in their lives. And but also I think you were talking about even like supporting afterwards too, whether it's situations like yours or any other type of chronic diseases, or maybe even cancer diagnosis. After people have been maybe cancer free, we can also help support them afterwards too, correct?
Yeah, exactly. And the main thing with functional medicine is that food is medicine. It's that, I think Hippocrates said that, right? Let food be thy medicine. And it's an ancient principle, but it's, for some reason, getting its day in the sun these past few years, and now it's people are more open to understanding that.
Mm-hmm.
And it seems kind of crazy, because that should be the number one thing we start with, is changing our lifestyle. And it's not just, functional medicine isn't just nutrition, it's lifestyle changes. So getting enough sleep, reducing stress, the self-care part of it as well.
Mm.
But there are so many people, and it's something that, I've worked with a lot of different clients over the past almost 20 years of being a massage therapist. And I'm working on people's muscles, yes, but in those sessions, I hear people complain about other things. And it's a crazy statistic, and I wish I had it on hand, but people walking around with a chronic disease of some sort, whether it's something like just adrenal, well, I shouldn't say just, but feeling fatigued. They're having joint pains, brain fog, all of these things that people tend to just live with and deal with that aren't normal. Like, it's something that they can heal in their bodies, through lifestyle changes, through nutritional changes. And I think that's kind of like the message that we need to get out, is that, you don't need to be suffering.
Yeah.
We can make these changes, and we can help you make these changes.
Yeah. Awesome. Thank you for sharing that with me today, Keryn. That was some really great information, and really personal. So that's great that you're willing to share that today. I appreciate that very much. I'm sure everyone else does too.
Yeah.
Awesome.
Absolutely.
Thank you.
Thank you for joining Holistic RI. Our mission is to improve the health of our community through education and holistic personalized care. Lead with your heart and listen to your gut. Our full disclaimer is as follows. This video is for educational purposes only. The content, information, and opinions shared in this video are for educational and informational purposes only. They do not substitute professional medical advice, diagnosis, or treatment. They are not intended as a substitute for any of the above. Professional consultation. Please always seek the advice of your medical professional with any questions you may have regarding a medical condition or before starting any new diet, exercise, supplement, or wellness regimen. This video does not offer medical advice and is not intended to diagnose, treat, or prevent any disease. Do not disregard professional medical advice or delay seeking it because of something you have watched or read here. Individual results may vary. Any testimonials or examples of results are based on individual experiences and may or may not be typical. Results are not guaranteed and will vary from person to person. By watching this video, you acknowledge you are responsible for your own health decisions.